The UK's COVID vaccine programme has been a huge success. Only a handful of countries can boast a better rate of jabs administered per 100 people. And now the UK has hit its first major target, offering vaccines to everyone in our top 4 priority groups by February the 15th. That covers around 15 million people, the most vulnerable out of an adult population of 53 million.
Vaccines save lives. They protect you, and there's increasing evidence that they protect all those around you as well.
So how has Britain reached this ambitious milestone? Here are 5 key reasons behind the success of Britain's vaccination programme.
Firstly, we ordered more than 400 million doses. That's a lot of vaccines, and enough in theory to serve all of Britain's adults more than thrice over. And the investment has been substantial. The UK has spent nearly £12 billion on the purchase, manufacture and rollout of the vaccine. Secondly, we ordered early. The UK signed its contract with Oxford-astrazeneca vaccine 3 months before the EU, giving the UK a head start on its neighbours. Thirdly, we spread the risk. Ordering 7 different types of vaccines early meant any downsides were mitigated. The Pfizer vaccine was available first, allowing our vaccination campaign to start before any other country, but it required doses to be kept at around -70 Celsius. We only had to wait another month before the Oxford-AstraZeneca jab, which is cheaper and can be distributed far more easily, could be rolled out. 4. We used the national infrastructure of the NHS to get it out efficiently. That meant using mass vaccination centres and hospitals, but also GP centres and pharmacies, making it possible to serve local communities and to reach the most vulnerable. We also took a highly controversial decision to extend the time between doses up to 12 weeks. This meant more people got their first dose more quickly. And it's a decision which appears to be backed by the latest scientific evidence, suggesting that it also strengthens the immune response. Finally, we learned from previous mistakes. A task force was put in charge of the programme, with a dedicated minister, later appointed Nadeem Zahawi, and those in charge were careful not to make promises too early. The target of reaching the top 4 groups by mid-February, for example, was only announced in January.
It all means that the UK can have genuine claims to have a world-leading programme, and ministers will hope that the pace of rollout continues. By the end of April, the target is to cover another 5 priority groups. That includes all those over the age of 50, as well as younger at-risk groups. And ministers are already looking to have offered a jab to every adult in the UK by early autumn, with hopes that this could be achieved sooner. It is then that the government, which has been fiercely criticised over its handling of the pandemic, can lay claim to a genuine victory. And even then, there may be no time to slack off. Already, scientists are attempting to adapt the current vaccines to respond to new mutations, which could mean that Britain has to brace for a 3rd booster dose before next winter draws near.